This is Dr. Smith at Malera Eye Care, and today we want to talk about the Tempsure NV device and how this works in for your dryness symptoms and a lot of the treatments that we recommend doing here at the office. Whenever we have dryness, it's a very much a multifactorial approach, and when we say that, from a lot of different directions you can get the symptoms that you do. One of the major reasons that you can have this is the glands inside your eyelids, called meibomian glands, that make an oily substance necessary for your tear film and necessary for your comfort. Just like any other oily, fatty substance, over time this can clog up, and when those glands get clogged up in those spots, that's where you get a poor tear film and a lot of the symptoms that go along with it. Now, to get any oil substance moving, one of the best ways to do that is with heat. And a lot of times in the exam room, we recommend a warm compress on the eyes to try to move through some of that material. For someone with relatively mild symptoms who's not having a lot of major problems, that can work just fine. But whenever we get into a little bit more moderate to advanced dryness, we want a more direct approach. That's where this Tempsure NV device comes in. And what this is great for is it uses radio frequency to have direct heat right where we want it at those glands themselves. So the technician and esthetician who perform the procedure are going to use a handle similar to this one, and the heat is going to come right from that nozzle at the end there. And they'll just move it along the outer edge of the eye, and that's going to radiate into those glands to move through a lot of that thick oil material that's just built up over time, and try to push that through as much as we can. And once we get that unclogged and get good flow, that's where a lot of symptom improvement can come from. And you'll hear of a lot of devices these days that try to attack it in the same way. Another common one is what's called an IPL device. The big limitation there is certain skin tones can be very, very vulnerable, and you can get actual low degree burns and things from that device, where the radio frequency that the Tempsure uses is just as effective and more applicable to all the patients that we see, so that every single person we target with some more of that moderate to advanced dryness can really get a very big benefit from it itself. This is also a process over time, where you have one procedure done, we get those glands nice and clear, we have a good run of time. The process is still ongoing, where they can reclog, that oil can thicken up again. So that's why it's something that, working with your doctor, we're going to set a reasonable schedule to make sure we're keeping track of this over time and using the appropriate treatments whenever we need to.